I think it's really important that you all know that A, we're open for business in the emergency department. We're ready to go. We've got our trauma team ready to go. We have our cardiology team ready to go. We have our stroke team ready to go. So anything you need from an emergency standpoint, we're ready to go. I also want to give you some assurance that we're taking every measure we can to keep everyone safe. We screen all of our patients today as they walk into the emergency department. We give them a mask if they need to have a mask on, and that's been very helpful. And then we try to get them back to a room as quickly as possible. We have areas of the ED that are set up for COVID-type patients, and we have areas of the ED that are set up for non-COVID-type patients. So we don't mix the two people. Sometimes it's really hard to tell up front, so we also have another area that's really kind of a warm area, we call it, and that's where we put people that may or may not have COVID symptoms, but predominantly don't have COVID symptoms. So we see a lot of people that come in with shortness of breath, and maybe that shortness of breath is from heart failure, or maybe that shortness of breath is from COVID. So we try to sort that out as quickly as possible. We have seen some people that over the past several weeks that have delayed coming to the emergency department. And what I want to assure you today is that if you feel like you may be having a heart attack, or you feel like you're having stroke-like symptoms, numbness in your arms or legs, weakness in your arm or leg, inability to speak, or other problems like that, you need to come to the emergency department right away. If you delay that care for a couple of days or 3 to 4 days, as we've seen with some people, then that really takes you out of the window of opportunity for us to intervene to improve those symptoms or reverse the causes of your stroke. The same thing with chest pain. If you're having a lot of chest pain, then you need to come to the emergency department right away. We can intervene quickly. We can take you to the cath lab if we need to. We can give you medications that can make your heart attack less severe and before that permanent damage is done to your heart. And the same thing with the stroke. Before that permanent damage is done to the brain, there are certain people that we can intervene on. You don't have to be concerned about catching COVID from coming to the emergency department because of all the precautions that we've taken. We also have a really good sterilization technique that we use now with ultraviolet lights and other cleaning materials, that when we have a patient that has COVID or suspected of COVID in a room, we clean that room for 3 hours after they've been in that room and make sure that that room's 100% safe for the next person that comes in that room. Also, we've made every single one of our rooms a single room, so there's no shared patient rooms at all, and we want to make sure that you're the only one in that room so that you're going to be safe. If you have symptoms like shortness of breath, they may or may not be COVID, and you feel like you're having quite a bit of significant shortness of breath, then I would encourage you to come to the emergency department for an evaluation. If you have COVID, then we can manage that appropriately. If you feel like you have just a little bit of a dry cough and you're not feeling well, and you have a fever maybe not, it's okay to stay home. Parkview has some walk-in clinics that are still open, and we also have the respiratory clinics, and the respiratory clinics are really geared more for people that have cough, congestion, runny nose, things that may be COVID or may not be COVID. We can do testing there for COVID, and we can do testing in the hospital for COVID also. One of the limitations that we do have now because of COVID is that we have a visitor restriction policy. So if you bring your family member to the emergency department, you won't be able to come into the emergency department. That's both for your safety and for the safety of everyone else, and also to preserve our protective equipment so that we don't have to use that if it's not necessary. But if you bring someone to the emergency department, we will take your name and your number, and we write it on a special piece of paper so that we can contact you. You're more than welcome to call back at any time to check on your loved one, but we also will give you a call to let you know what the findings are, how things are going, and what the plan of care will be. It is important for you to let whoever picks you up or brings you to the hospital, if you do have chest pain and you call 911, but you also have a fever or some other symptoms that you're worried about COVID, that you share that with the EMS people, because everyone around you needs to know that you may or may not have COVID. And if you don't have any fever or you don't have any respiratory symptoms, but maybe you just have severe chest pain, then let us know and we'll still take the appropriate precautions at that time. We absolutely are open 24/7. We will be able to take care of any emergency today, just like we could in February or January or last summer. So come on in and we'll be able to manage that just appropriately.